Hi, I'm Viv, the face behind Skin Farmer Aesthetics in Stockton-on-Tees, and tonight I thought I'd speak to a colleague of mine called Balsam, and she's hopefully going to join me in a minute. And we're going to be talking about Acne Awareness Month. June is Acne Awareness Month, and we thought it'd be a good idea to talk to each other about that and find out more about acne. Hi Helen, Self Aesthetics UK, hope you're doing well. I'll just see where Balsam is. I've spoken to her a number of times before, and she generally has a lot to say about different topics. So I'm just going to see if I can find out. Wait a second. Let's have a look. No, nothing yet. I'll just wait to see where she is. Shouldn't be too long. But yeah, acne, it's a condition that affects a lot of people, unfortunately. And I see a lot of my patients with acne problems who generally have issues having had acne previously in years gone by, usually as teenagers. Hi Balsam, hope you're doing well. If you join me, hopefully you should be able to join me. There we go, let's have a look. There we go, she shouldn't be too long.
Oh, here we are.
There she is. How are you doing? Nice to I'm fine, yeah, nice to see you. You're at work, are you right now, Balsam?
Literally just finished, like literally. Let me close the door. Hang on, give me a second. Let me close the door. Okay. Yeah, I've just literally finished.
Yeah.
So pack, chucked everything. So if you look quite nice and neat, it's because everything is at the corner.
Oh, right. Oh, as long as you're keeping well yourself, anyway, it's nice to see you again. We've spoken a few times about different topics, and tonight I was just mentioning there, we're looking at Acne Awareness Month. June this month is all about acne, and we both deal with patients with acne problems, unfortunately. We're both pharmacists, and we've worked in the NHS for too long, I think. Many years. I've been working for like 27, 28 years in the NHS, and acne is a big problem for patients. So I thought I'd speak to you about it. And one thing I didn't realise before earlier today, a few hours ago, is that acne has affected you personally, hasn't it?
Yeah. So I've had it for years, and I'm talking about decades, not just years. And I've had it all the way through to my mid-30s, in fact. So I've tried everything. You know, when people say they've tried everything, they haven't really tried everything until they come to a space like the ones we have in aesthetic clinics. But within my knowledge and within what the NHS can offer, I've tried them. So you know, done the myths and I remember just today putting a post up about the toothpaste. Now, I was a toothpaste girl. I used to put that toothpaste on my face. And I don't even know why we have like this zit community in those days before the political correctness of what you should say. But we all did the same thing. We just put toothpaste on our faces. We tried everything. Now having to sit there spending 2-3 hours trying to cover a spot and another spot and another spot and another spot, feeling so self-conscious, feeling your confidence is down, feeling feeling that you are inadequate in a way, even to establish simple relationships and friendships, feeling that everyone's just looking at your spots rather than looking at you, or if they're talking to you, they're not looking at you think they're not looking into your eyes, or they're not looking facing you, but they're actually focusing on your spots. It's quite debilitating. It really is quite debilitating, to a point that, and I remember saying that to you before, hair used to be worn right across my
Yeah.
face. You always look down, you always hunched, you know, you're caked with makeup, and actually your makeup looks incredibly dry as a result of it, and it's no good for you, because in those days, even the makeup, we're not talking about millions of years ago, but come on, you know, cosmetic industry has evolved a great deal, but
Yeah.
makeup wasn't non-comedogenic. Oil-free formulations weren't that popular, so you end up adding insult to injury. And
Yeah.
the thought of having to be the wash and go girl, or the, you know, slap a sun cream, even the sun cream, that was something else, or, you know, slap anything on and go, slap a lip gloss and a mascara and go girl. It wasn't that type of look that I had, you know. So it does debilitate you without a shadow of a doubt. It
Yeah.
makes you feel so vulnerable. So
Yeah. Yeah.
I vowed that this is going to be one of the biggest focal points in my profession, to help
Yeah.
those who've walked those journey with me or are about to embark, so they don't have
Yeah.
to go through what I had to do, and literally
Yeah.
go through the system, until I actually got isotretinoin as a medication. But how lovely it is not to be able to be on this medication, and I do respect that medication a great deal, and I think
Yeah.
it's a wonder drug, but it's not for everybody, you know. So
Yeah.
that's the reality. It's not for everybody. So
Yeah.
how wonderful to be able to offer a complete care solution to someone's
Yeah.
skin health without having to go into these drastic measures, if it's possible.
Yeah.
And now here we are in this position. So yeah.
Yeah, it's not all healthcare practitioners are in the same position as yourself, knowing what it actually feels like to be affected by a condition that you would normally treat for somebody else. So in some ways, you've got better hindsight and you've got better personal knowledge about the effects on people in a normal day-to-day basis. So I think you're fortunate to be able to be in that position. So with acne, I think, well, I was going to just talk a little bit, just a small amount, just about the condition itself, what normally is done to treat it, and really more to do with what we can do to help patients with problems associated with acne. So acne, we both learned about different skin problems, different treatments available for acne. Generally, acne, it may well have happened with you in your teenage years. Increased oil production, increased problems with certain areas of the body, the face, the neck, the back, the chest, possibly. It's to do with what's known currently is the fact that it's changes in the skin that are caused by production of oils. And the oils are affected by hormones that everyone produces naturally. In individuals that suffer from acne, unfortunately, the oil-producing glands around the body in the skin are more sensitive to hormone changes. And even normal hormone changes, unfortunately, in acne sufferers can produce a reaction of excess oil produced from the skin surface. And when the pores are blocked as a result of this excess oil production, it can create the symptoms of acne, which is spots, redness, inflammation, and pus production of pus, unfortunately. And the causes affect how the treatment's carried out. That's the reason we need to know what the problem is in order to be able to treat it properly. Now, for yourself, was it the normal classic symptoms of acne that you'd get from time to time?
Well, yes. So I had the, so as a patient, or as a personal perspective, or from a
Both as a patient and as a practitioner.
yeah. So I had, you name it, I had it. So I had the pustules and the papules. I had the open comedones, and I had the closed comedones, which are really the whiteheads and the blackheads. I had the inflammation. I had the rawness. There were pus. My spots had spots, and it got to a point that if I didn't do something about it, it would turn nodular, and then it may create a bigger problem, which is the scarring, because we don't want to end up with a reminder of what we went through. So prevention or early treatment is better than trying to rescue and damage limit and remedy and fight fire and what have you. So
Yeah.
I've had them all, and as we know, that acne has different gradings. There could be a mild to moderate to severe to really severe. So I literally had everything. And what happens to every single acne sufferer is that they tend to then go into this frenzy of overwashing. So they wash and wash and wash and start using, just thinking in their mind, their skin is very dirty. So they start to clean, and they start to do their home surgery. Let's not forget the home surgery, where they start to pop their own zits and then embedding the infection well within. So when you end up with a situation that your skin is incredibly dry, it turns into an overcompensatory mechanism to try to substitute for that moisture. Then you end up with extreme blockage, and then with that extreme blockage, the cycle starts to continue. And then we need to, so here we are. Do we then now start to go to a convention route? And the NHS has a convention route that's actually governed by the NICE guidelines, and we have a NICE guidelines in place that we do tend to adhere to, depending on the type of acne grading, whether it's primary care or secondary care. But it gets to a point then where did you go from here? What other options are there available? If I knew that laser could help me, or IPL could help me, now we have a wonderful machine such as the Aerolaser that works into micropulse of the Nd:YAG that treats all skin types. If I knew then that would help me, then I may have been able to gain access to it. But was it available at the time? I'm not so sure. If I knew all those peels that are available, or the concoction of all sorts of things, rather than to have to go to the root of the antibiotic, which I am not an advocate of personally, because I'm not treating the cause. I am just treating the bacteria that's causing the acne, but not the acne, the reason for the acne. So get back to the cause and see the reasons why this is happening. So did we go for the wonderful retinoids that we have in place right now, you know, the pharmaceutical retinoids, or even the skincare maintenance retinoids that we have in place that we didn't have in those days? It was pretty much very much NICE guidelines type, and we still have to respect those. They're there for a reason. But just know that outside the NHS, where there are budgetary constraints, there are solutions that we be able to work with. But yes, I've had them all. I've had it all. But did I use everything? Did I try all? Well, no. Now that I'm in this position that I'm in, I absolutely didn't try all. You know, so much I could have had. Maybe it wasn't there at the time. Who knows? Yeah.
So there is a lot more information available about treatments available for acne sufferers. Acne, it's not just the condition itself which is a problem. It's the long-term effects of acne as a teenager. It can happen at any age. It generally starts in the teenage years during puberty, but it can actually appear at any age, unfortunately. But the patients I see in my clinic, a lot of them, unfortunately, have had acne in the past in their teenage years, when they're 12 to 18, around about that age, they have symptoms of acne. And they unfortunately pick at the spots, they squeeze the acne spots, they cause problems with scarring, and scarring is one of the biggest issues with acne as a condition, unfortunately. And the problem with that is the NHS do not treat on a normal basis the side effects that are created as a result of acne, the condition itself. So scarring and pigmentation problems happen, and you'll know from people you see and treat in pharmacy and in aesthetic work that those problems are treatable, but it's not always treatable on the NHS because of it being classed as a cosmetic problem. And because of that, I think patients don't always know what is available for them to use to help them following a period of acne suffering. So I think what I thought would be a good idea for us to talk about really is your experience of treatments that have worked, and also issues you found in your patients that are looking for effective care and treatment following acne. So, as I say, I've got patients in their 30s and 40s. They've had acne in their teen years, and they're now looking for ways of helping them with scarring problems and pigmentation. So in terms of that, there's different treatments that are available. There's things like laser treatments, as you've mentioned, laser resurfacing treatments, steroid treatments, which sometimes are used as injections, microneedling, a few other things. So I thought we'd talk about that if that was a good way to get into the area of treatment.
Yeah. So the first thing that's the most important part. Before I begin, am I going dark in this?
No, you're nice and bright.
Are we? Okay, because it's gone dark. Anyway, I don't mind because it looks quite demure. That's fine.
You're fine. You're fine.
Okay, so the first thing I'd say, the most important thing that is the consultation, because this is where we need to make sure that we have all the elements of what makes an effective consultation. So whether it's communication through what I call music and dance, which is basically observing both the way that I come across, plus my body language, as well as the patient's body language, because a lot of the communication can come through unspoken words. A lot of them, it could be an embarrassment, it could be something that they can't really talk about. They need to just, sometimes they dilute the problem, or they dilute the concern, which they try to sort of make it not that much of a bother to them. But then once you start to unravel, you realize actually it's quite a big problem for them. So the consultation is key to identify where they are in the journey, any family history, any sort of lifestyle, because bear in mind, as you said, we are both pharmacists, but we both also worked extensively with the public. So we don't just sit there and look at just the medication from the drug or the pharmaceutical or the prescription only. You know, that we look at the well-being, we look at the supplementation, we look at what they're eating, we look at the lifestyle as a whole. So you encompass everything there, and you take whatever you've learned in your past and you bring it forward into what you're doing there, because it has to be a relationship between you and that patient, and you are walking an acne-free journey rather than an acne treatment, and that's so important. So once you've identified that, obviously, when it comes to their age or medication and the history, then you begin to tailor. But the tailoring a treatment has to be a two-way approach. So some people may not be able to have the laser treatment that they want to have, because maybe they'll be, no, it's not really a case now or recently because of COVID, but a lot of the times they may have had sort of sun holidays. Maybe that's not something that they'd be able to have. There are many laser treatments that may be not suitable for certain Fitzpatricks, so we need to be able to make sure that we offer the right equipment for these patients. For me personally, I am more of a progressive rather than aggressive type of treatment approach. So I would go for a progressive approach to rather little and often to get there, rather than blast and try and source it out from there, because we have to get into a journey, and that journey doesn't incorporate the treatment itself. It has to incorporate the maintenance of it, and the maintenance has to be skincare. This is 100% key to everything that I do, that regardless of the treatments that you would give, it will only be as good as what it is. But if you do not feed it with the maintenance of skincare and also some protection, you will be back to square one, and we're finding that we're having to keep chasing. Yeah. Do I combine prescription only medication, which is apart from the retinoids, with my treatments? Yes, if there is a need for it, and if I feel that there is a clinical need and I weigh the benefit to the risks, yes, as a prescriber I would. Do I like to give antibiotics on a long-term basis? No, I don't. I am one of them. I had them. I didn't, it really affected my gut. I don't think I need to then start to clear something else because I'm trying to address this thing. I had patients who had ear tinnitus as a result of their long use of antibiotics. So do I really want to put a patient through that? No, there is no need. In terms of In terms of acne scarring, we've got to make sure that we know the type of scar, whether the scar will work for this patient. Not all scars will be treated with these devices. So identify the type of scarring that we have, whether it's ice pick, rolling, box scar scarring, and then find how we can work towards them. Sometimes a multidisciplinary approach is much better than a unified approach or a singular approach. It's always better to have, as you are doing a beautiful dish, you never just put salt. You will always just see, you'll add your own ingredients into it to make sure that you reach the desired outcome. Similarly with this, identify the issue, identify there may be multifactorial issues. There may be a scar, there may be active acne, there may be hyperpigmentation, there may be all sorts of reasons that this patient has, and they are also worried about their lines and wrinkles. Because acne is not teenage only. It could be perimenopausal, postmenopausal, and now we are faced with the perils and the dreaded situation with the maskne. So much going on at the moment with regards to acne, not just the conventional, oh, I've got spots. So you've got to reach, your treatment has to be as individual as the patient that you're treating, and no two faces are ever the same. That's my approach to it. So there's a protocol that you have from a safety perspective, but you tweak, you harmonize and amalgamate towards in order to reach the most suitable treatment outcome.
You mentioned about skincare. It's something I think that people perhaps don't realize can make a difference in terms of improvement of acne symptoms. But again, it falls down back to going to look at the cause of the problem in the first place. You can't just throw medication at individuals to sort a problem out when you don't know what the actual cause of the problem is. And that, unfortunately, is a big problem in aesthetics. The principles we use to treat patients in the NHS don't always seem to translate in the world of aesthetics, I find. I use principles I've learned in the NHS to do my aesthetics work. But when I speak to other practitioners, they seem to have completely forgotten what they were doing in the NHS and following a protocol and treating patients according to what the problem actually is, not just guessing and throwing drugs at them willy-nilly. But in terms of skincare, what would your advice be in terms of use of skincare to patients with acne problems? Perhaps they've got acne already, or they've got the problems associated with scarring, or trying to maintain their skin in as good a condition as possible with the problem of acne in the background.
So the most important thing is do not overdo it. And I speak that from a personal perspective as well as a professional one. A lot of us, including myself, overwashed, over scrubbed, over exfoliated, overdid everything. And that causes a compensatory mechanism where you've got then a rebound effect of oil secretion, and then you end up with adding insult to injury. So there is a notion that the skin is not clean. It's not that at all. It's what goes on from within. So make sure that the skin is hydrated. Being moisturized and hydrated are two separate things, in fact. And so, and be mindful of what products you use. So gentle cleansers, great, as well as non-comedogenic cleansers, they are fantastic. And sometimes you're having an exfoliating which with mild acids is not a problem at all. There are acids that are incredibly gentle compared to the bigger ones. So we know salicylic acid is incredibly important when it comes to acne. There are other counter medication that would have a small percentage of salicylic acid in them, but also we have others that are such as mandelic acid. Mandelic acid is a larger molecule, but it also has an antibacterial effect. So we have solutions that can have these ingredients in. Other formulations that are supplied within the active world may use botanically derived ingredients, and they are fantastic. They're fantastic for those who may not want to use the sort of the, I wouldn't say natural. There is no natural in this world. It bugs me, the word natural. So there are botanically derived or maybe synthetically derived, but you know, they work. You know, some people, you have to give people options. So retinoids, in terms of creams, they can vary from your retinols to your retinoic acids. Now, in between those, there is something called retinaldehyde. You know, but be mindful that the way that the retinoid family works as an umbrella of vitamin A, not all of them are there to tackle acne. Some of them are anti-aging, whilst others are acne targeted. So when you look at the acne target ones, there are the adapalines, there are the tretinoins, they are, you know, these are the ones. And of course, if you want to go hardcore, then we're looking at the oral acetretinone. But to maintain good maintenance and making sure that your skin is fit, skin fit, is ensuring that you have got your hydration in place, gentle moisturizers. You can use exfoliating agents, which with low percentages of glycolics and mandelics or salicylics, and there are plenty there, and hence the reason why we are in this position, that we are able to give that consultation to once we see that patient and see how how their skin performs and treats, because it's a journey. Now for me, in terms of the most important maintenance, I would say, regardless of whether you have acne or no acne, is sun protection. Sun protection reduces the risk of hyperpigmentation. If you have got a situation where the skin is compromised, then the last thing we want is to not be protected. On top of the acne, we're going to get premature aging, and then on top of it, we may get the risk of skin cancer. There are beautiful formulations out there, and I do stock certainly. There are acne oil-free sun protection. So it doesn't really have to be, you know, sticky, tacky, rocky. You know, it doesn't have to be any of these things. There are oil-free formulations that are non-perfume, very non-comedogenic, hypoallergenic. Even though those terms, the hypoallergenic is a very vague term in terms of testing, etc. But still, there is some sort of allergy testing that's been done. But anything that does not block your pores is your skin, despite this, it may be over secretion of sebaceous, of sebum. You still need moisture. You still need hydration. You still need hydration. So anti-inflammatory products. I am a great advocate of beta-glucan. As you know me, I've always talked about beta-glucan more than hyaluronic acid, because I feel beta-glucan does a lot more as an anti-inflammatory, and also it does more than retain water. It actually penetrates deeper within. So keep your hydration into your skin, and acne-prone skin, that's incredibly important. Make sure that you use items that are gentle, but able to even try to slough away that layer of the skin. Sun protection is my biggest best friend. I will never leave home without it, regardless of any time of the year, because I want to make sure I reduce the risk of hyperpigmentation onto my skin. And hydrate. That's really, really important. And then just watch out what even type of makeup. There are lots of makeup now that's non-comedogenic, that is acne friendly makeup. So you know, there are lots of counters there, and you know, luckily I do love makeup, and I do like to use makeup, and I can give you a very embryonic advice on makeup. I'm not a makeup artist. You can see it doesn't look like a makeup artist, but I will say what exactly, you know, what you should go out for, what brands may be available for patients to maybe explore, you know. So and then the rest will be the great girls on the makeup counters. They'll be able to give that advice. But try to minimize the makeup. But everybody, you know, we want to celebrate whatever style we want to have. And we shouldn't let acne be the reason why we don't. So let's clear it and or manage it, and to reveal more confidence.
No, that's good advice. I think people sometimes find it very difficult. We've spoken before about cosmetics and cosmeceuticals, as we call them, based on evidence-based ingredients in cosmetic products. And as you know, I've got my own range available because of problems with people just not knowing what to use. And there's such a big range of cosmetic products available for different people, different skin types. And I think the whole issue of different skin types is just brought ahead by cosmetic companies because they want to build a bigger and bigger range of products that they think suit a specific skin type. But skin is the same in everybody. There's variations that can cause certain problems, but we know what works in terms of good skincare. And I think it's a question of letting people understand and letting them know what is effective and what we know isn't. And that I think can help a lot of people become more confident in being able to buy products that they will hopefully get a benefit from. It's difficult to say everything will work equally well in everybody. There's always variation, but if we base it on evidence and we can treat patients based on that, they're more likely to understand why we're doing something, and they're more likely to gain a benefit as a result of following advice that we give them. That's what I find. But there's a lot of products available, and people will always have difficulty. So in terms of supporting them, what would you say if somebody was bothered about an acne condition, say they're watching this and they're thinking to themselves, Balsam's talking about different products, but where do I start? What do I do? Where do I go? What do I do as a patient? She's telling me all this stuff about following advice, everything being tailored for everyone individually. But where do I start? What do I do? I've been to my doctor. I've been on different treatments. I've been on Zinerit. I've been on treatments where I rub creams and ointments on my skin. I've been advised to take antibiotics and I don't want to. What shall I do? I've got a problem and I don't seem to be getting any help at all with my acne. What would you say to them?
God, it sounds like me when I was young. You just described me at that time, and it's exactly how I felt. You know, we are put into this stepwise fashion of how we, whether you're going to use a benzoyl peroxide and then you can add some sort of retinoids, or you may add an antibiotic with the benzoyl peroxide until you go to a point before you tear your hair out, or draw circles of lip line around your spots to say, look, doctor, can you just see, are you, you get to that point. And I have to say, hats off to the medics now. The GPs are far more receptive to the concerns of acne sufferers. Before it was, oh yes, it'll go away. You'll grow out of it. That's a lot of what I had at the time. I think it's really important to reaching out to people like us, and I hope people feel that they are happy to reach out. We do offer consultations, and we offer video consultations, so you don't even have to be in the same city to do it. You don't have to be physically here in my clinic to do it. So really important just to speak to someone to understand how your concerns, your ideas, your expectations, your goals. We are here for you. Unless we know what is bothering you, we will not be able to formulate a plan to treat you. And this plan is a management plan. We will walk that journey. It's called a journey and not a treatment. And I keep having to actually emphasize on that. Everything is a journey, because with that journey, you get to know your practitioner, and you get to know your practitioner's way of trying to help you, and they get to know you. So that relationship is important for you to get that shared outcome, that shared agenda, and that finish line. And the rest is maintenance. So what do I say is, I wish I had someone like me, Vivek, when I was younger me. I wish I had someone like you when I was younger, because I had to be the person that has to search through this. And thank goodness, I've got a pharmacology degree under my belt. I've got a pharmacy degree. Now I've got a prescribing, qualification. So I didn't go there with no knowledge. I went there with a fair amount of pharmaceutical knowledge, and also working. So it's not as if I went there completely blank. And yet still I felt I was in a jungle. I still felt that I was trying to fight to be heard. And that's something really important for those who aren't in a position that I feel I was in a better position, and yet I still felt I wish I had someone like me and someone like you to reach out to and say, how can you help me? How
Yeah.
can you help me? What
Yeah.
options are there apart from my Panoxyl and my Zineret and my Duac, and is there anything else that you can do for me apart from that?
Yeah.
Or I don't want to be on linocycline. I don't want to be on erythromycin. I don't want to be on these medication. Where do you go from there? So it's
Yeah.
really important that we offer a complete care solution to this.
Yeah.
That may not necessarily be ingestion
Yeah.
or vulgaris
Yeah.
application.
Yeah, there is a lot of support available for acne sufferers, and I think perhaps a lot of people don't always see beyond their doctor. Perhaps they've been to the doctor, they've been treated for acne, maybe some years has passed and they've been left with the problems that they may have had as a result of the acne from years prior. And as I say, I see patients, unfortunately, with the remnants of acne, the scarring problems in particular. And I carry out particular treatments for acne sufferers that have scarring problems. I use certain chemical peel treatments that work well. There is a number of different treatments. There's also non-surgical treatments. I use treatments including subcision, needle subcision, to actually help with scar tissue reduction. And there's lots of cosmetic treatments available for sufferers. It's just a question of education, I think. If people have a better idea of what's available, they've got a better idea of what may help them with a certain condition, they're more likely to try and find out about it. As you say, not everything suits everybody, but that's why it takes somebody that knows about the subject to talk to them about it properly and look at the options, weigh up ideas, look at what's actually bothering the patient in the first place. Did you have problems with scarring yourself?
Well, I'm going to be honest, and since it's just you and me listening to each other now. Well, I started, like I said to you, I came into this, with my skin condition. I felt it's a jungle out there, but at the same time, I came there knowing exactly what drugs are what. I've done a degree before. I've done another degree in pharmacy. I've got a fair amount of knowledge of physiology and pharmacology, and also pharmaceutics. So and I still had to really find my way. So I thought, well, the only thing that's missing in my life is to introduce a psychology in it. No, I wasn't heard, Viv. I had to go to the doctors and say, you know what, doc? At this rate, I'm never going to get a boyfriend. I'm never going to get married. I can't, that is what I honestly, that's what I said. And they said, I'm never going to get, I'm finding it really difficult to have relationships. And it's not that I'm lying about it, because a relationship doesn't have to be a intimate one. It could be being amongst friends and peers, and you feel, I wish I had that. I don't want to be sitting there in the camera when everybody's taking a photo, shying away. So it doesn't really have to be. This is all of these things really does affect. And yes, we have acne positivity and acne, but let's not try to normalize something that can affect people. Whilst everybody's right is to look and feel beautiful, and everybody's beautiful from within, and everybody's skin is beautiful. However, let's not try to force somebody into normality when they are not feeling comfortable about the way they feel. So it's everybody's right to feel if they are confident to be with your skin that happens to have acne, no problem. But let's not box people into this situation that you are beautiful as you are. Yes, we are. But let's not try to drive people forcefully into that. We've got to make sure we don't normalize the situation. We allow people to have the option to be who they are. If they want to stay, fantastic. If they don't, they've got mechanisms that will be able to help them. People will be able to reach for them. Now, got to that point where if I wasn't at that point where I had to reach out and introduce the psychological aspects into my situation, into my plight, then I was referred to secondary care, where then I went on to the isotretinoin, and I was placed on isotretinoin. And with everything that was, read the information leaflet, I knew that there were situations that you felt like the suicidal tendencies. My goodness, I felt really terrible. But I vowed, even in my pharmacy, that I would tell my patients that you will feel this way, but don't let that be the at least you know. Now, if I didn't go on that, I would have been incredibly scarred. And even when I see myself against the light, there is an element of roller.
Yeah.
I see that. I do see that. So whilst it doesn't, and I worked on skin resurfacing, I microneedle my face myself. I do that. If I can do it to my patients, I do. And I'm meticulously religious to microneedle myself every 4 to 5 weeks. And I do that without shadow of a doubt. I will never go without. So there are things that I would do to make sure I support my infrastructure of my skin now that I know more.
Yeah. No, it's good that you can talk freely about how it's affected you. I think a lot of practitioners, healthcare practitioners, in my experience, don't always see how problems like acne affect the patient in their normal lives. They look at figures, they look at statistics, they look at symptoms, but they don't really look at the person as a whole. And I think that's one of the problems with being treated in the NHS when you've got a problem like acne. You seem, in my experience, I can't talk about anyone else, but in patients I've seen working in pharmacy, working in surgery, working in primary care, the patients feel like they just are never heard. They're never listened to. Nobody's listening to anything they're saying. And drugs are getting thrown at them on prescription. They get put on repeat prescriptions. Nothing's helping. They're getting more and more mentally drained as a result of it. And I didn't realize just how big a problem anxiety and depression is in individuals that suffer from acne. I honestly didn't know it was that bad.
I'm one of them. I'm an example of it. I was hiding away. I said no to a lot of parties. I said no to a lot of gatherings. I used to, when they used to take photos, I used to hide behind the last one where you can just maybe see a little bit of a, that was me. So for me to share that journey with, there's a fine line between sympathy and, you either have sympathy, which is we shouldn't be having sympathy. We shouldn't be dismissive either, but the empathy is incredibly important. So I share I'm open and honest with my patients. I share my journey with my patients. They need to understand that I relate to them. I hear them. I hear what they're saying. I know what they're going through. And that's really, really important. For me, it was psychological, and I wasn't in a good place. I didn't like it. Even down to your posture. Now you take your antibiotics, what is it going to do to your gut? And now everything is about gut health. Gut health and skin. Gut health and skin. So where do we go from here? It's a vicious cycle.
One of the things I was looking at is factors affecting the possible causes of acne and things that can worsen it. Diet, there's more research that's been carried out looking at the effect of diet. I think there's a lot more work that's going to be carried out in terms of dietary research. But things like foods, carbohydrates, sugars, in particular, foods that have got something called a high GI index, they tend to have detrimental effects on the skin in acne sufferers. And I think there's a lot more work that's looking at how that can be overcome. But one of the things that's suggested is to try and minimize really sweet foods, foods that can potentially cause problems in acne sufferers. Have you found that yourself in patients perhaps you treat or in yourself in the past?
Myself, certainly. And in my time, it was, there is no evidence to suggest that chocolate actually makes acne worse. But the beauty of science, it evolves, and you see more discoveries or revelations. There's nothing in life, in my opinion, as a discovery. I don't believe in discoveries. I only believe in revelations. It was meant to be. That's the time it's supposed to be. Bingo. So that's the reason why we are in this situation that we in my days, there was no, chocolate doesn't cause it. No, there's no evidence to suggest that chocolate will make your acne worse. But I'm thinking, but it did.
It
did. I remember it doing. But there's no evidence to suggest it. But now more and more it's showing. And also bear in mind that you know, what are they processed foods? Is it refined sugar? Is it, you know, what are, you know, even now milk, there's two schools of thought. Some say semi-skimmed is the one that's the acne culprit. Others say skimmed is the acne culprit. So we need to see who's going to win to be the acne culprit. But having a balanced diet is important. I think there is a lot of work about fermented food and making sure that your bacterial flora is in a tip-top condition. There are many companies that do sell you know, sort of gut stabilizers or anything that would be able to help that. We also have a prescription. It's not prescription, but a lot of doctors prescribe it, and I do recommend it as well, which is a probiotic specifically, just great probiotics. So there are ways you are nourished, you are what you eat, and what's inside tends to manifest. Remember I said to you before, I think in one of the lives, we know that the skin is the largest living organ in the body, and it's a powerful indicator of what goes on inside. So if we try to make sure that we deal with the gut health and adopt a more healthy lifestyle and work on our skin health from the top, we have a synergistic approach.
Well, that's good. This really was going to be a short live. We always end up talking for longer.
It's never short.
But it's always enjoyable. I always enjoy talking to you in a live anyway, Balsam. But yeah, that pretty much summed up what I wanted to speak to you about in terms of the fact that this is Acne Awareness Month. In terms of support for individuals, there's lots of sources of support. Patients that may well be thinking they've got a problem with acne right at the beginning. There's always NHS support that can go to the doctor. There is the likes of the NHS website people can have a look at, find out more about the condition. There's also charities like the British Skin Foundation. They provide a lot of great support, and they are a charity that are looking into research to try and help individuals with different skin problems, not just acne, but research is an important aspect of looking at how patients can be helped, not just now, but in the future. And I think the more work that's done to look at how improvements can be made, the better the outcome will be in future years for acne sufferers. But yeah, British Skin Foundation. Is there any other areas you could think of that patients could access information?
Important just to make sure that home into the NHS website will have that. I think there are forums, fantastic forums, just to make sure that you know and reach out to us, where we could then research for you, have more information. Also, there's understand the type of acne, because a lot of people tend to assume acne is perioral dermatitis or acne is rosacea. So if I have something here, then it must be, you know, I'm suddenly developed acne. So this is the importance of actually trying to identify, you know, is it the acne that you've had all your life, or you suddenly developed acne, or do you think it is acne? Just because it happens to be spots on your face doesn't necessarily mean it's acne. So there are many really different manifestations of a spot. A spot comes with different faces, not just one. So that's
I think, as you mentioned, there is support there available for patients with current acne symptoms that may be already being treated by the doctor. They may not think they're getting the support that they need. There's always somebody that they can speak to if they're not happy. And there's also, as I say, there's the individuals that may have had acne in the past and they're left with the problems associated following that, things like acne scarring and pigmentation problems. And that's where I think we come in now as aesthetic specialists, with our history in pharmacy and clinical pharmacy and prescribing. We've got a good background and we've got good experience in speaking to and treating patients with acne problems. I've done that.
Well, if it's something that we don't offer, I don't have a great big laser machine here. But I know enough, you know, working with the surrounding stakeholders or the community of clinicians around me, I don't just abandon this patient. This is being a healthcare professional. You don't just abandon that patient. They are a patient. They are not a client. They are not a customer. They are a patient. So you around my area, I know which clinics that will do, which have reputable machines and devices, because, and I know then I will say, well, you know, you do need to go to this, or I pick up the phone and speak to the colleague. I have a patient of mine, would you be able to see them? Would you be able to help them? Would you be able to consult them and see how we can move forward with this? Because what I don't have that modality to be able to take the next level or the next step. It may not be a next level, but that's specifically that type of modality is the most suitable option for them. So, you know, being in that situation that we are in, it's ideal because it's a 360-degree approach to skin health. And
No, that's good. I think that pretty much covers it. I think we've had a good chat about acne. We've had a good look at what's affected you in your own life, unfortunately. But it's also helped us to look at what can be done as a result of that. And hopefully patients and clients will find out about what can be done to help them, and there's people like us that they can speak to whenever they need to. And as you say, there's a network of practitioners that specialize in different areas of practice that we can always ask for advice from, or we can get the patients to speak to them directly. So there is help there for patients with acne.
Definitely. And what we don't want to do is get to a point where the psychology, where it leaves a scar that's beyond skin deep, and that's the one that we don't want to happen, you know. So, and it can. So treat it early. Just get, you know, just be all over it before it gets a little bit too far, and then we're having to fight fire or damage limit, or you know, it can be expensive at that point as well. No, that's excellent. That's excellent. I've really enjoyed chatting to you again about acne on this occasion. But we may well speak over the next few weeks about maybe other aspects of acne, or maybe other skin problems. As I say, we're both available to contact, and people can get in touch with us whenever they like. We're happy to speak to them about different problems that they may have, and hopefully this will have helped at least one person that might have thought about issues related to their acne. If it helps one, that's all that matters to me, really. If I just want to matter to one, you know, if that's just that one, it's absolutely fine. And I'm sure it's the same with you. It is. If there's enough that we've done today just to help one person, that's more than I think we could hope to do. Yeah, absolutely. And we are also acne sufferers, guys. So you know, we're not immune. And we still get them. We still get them. It's not that we don't get them, we still get them. We just know what to do. It's been great chatting with you again, Balsam. I'll just say thanks a lot for joining me, and it's been great talking to you again over all this time. It always goes on for longer than I expect, but that's always the case. Now you can come and help me clean up this. You're a bit far, but I'll do it via Instagram Live if possible. But anyway, thanks a lot, and this will be posted up now, and people can watch it when they've got a time. And if, as I say, if they want to talk to us and ask us any questions about acne and treatment for it, just get in touch, and we're happy to speak to them. Or info@dermrefine.com, and you are at skinpharma.co.uk. As I say, they can get in touch via Instagram, send us a message, and I do video consultations all the time with patients, so same with yourself, I think. Yeah, exactly. Great. Okie dokie, awesome. You enjoy yourself, and I will catch up with you over the next few weeks at least, looking at some other subject that we can chat about on Instagram. Perfect. But I'm sure we've got plenty to talk about. Yeah. Thanks a lot, Balsam. All the best. Take care. See you. Bye. Bye-bye.